So this will be a very brief, quick summary of what we're doing at Ulster University and what Neil and his team are doing at Queen's. So, just a tiny bit of background about Ulster University, because we're the new kid on the block. So these are some of our happy smiling faces of our medical students. We are a graduate entry medical programme, and we took our very first students in August of 2021. And what's nice about them is they're graduates, so they have a background in a whole range of professions. Some of them have been previous healthcare professionals, some of them have been scientists, and some of them have no background in science at all, or healthcare. And what they bring is a fantastic life experience, and I think that will make them really quite phenomenal doctors. This is really quick, and the reason for showing you this is because unlike most medical degrees where people come from school and study in 5 years, our students study in 4 years. So they have to work quite hard. And what they're doing is that they are cramming all that in, but they're bringing all their prior experience and learning to their practice of learning medicine. And I'm just showing you that diagram for 2 reasons. One is that I'm going to talk about year 1 and T year, so that's the first 2 years of the programme, and also that they learn in a spiral. And that's really important. We refer to spiral learning as an important educational structure, because students will learn something once and then they'll revisit it. And each time they revisit it, that's an opportunity for them to reinforce what they've learnt before, to approach it in a more complex way, and to apply their theoretical knowledge in a practical and clinical background. So what our students do is they're learning in groups, and from day 1, they are learning what we call problem-based learning. That means that each week they get a problem. It's based on a real case, a real patient, and they are learning all aspects of medicine about that case and that problem. And they're also in general practice in year 1 for 12 sessions. So right at the beginning, they're getting to know patients. And then we move them in year 2, and they are working in blocks of 5 weeks. So they're 5 weeks on campus in the classroom doing more problem-based learning. And then they're out in hospitals learning medicine and surgery, and they're also in general practice. And just that spiral is that in year 2, there's more complexity of the cases. And that moves us on to the next slide, which is an idea of the structure. Again, what I've just said, and then the next slide is, I think, my last slide. Told you I wouldn't keep you long. But this is the important one, because this is really where we have, with the help of Joan and Linda, we have introduced ME, chronic fatigue, for our students. So what we've done, and because you can imagine our curriculum is packed, students have to learn an awful lot to graduate as safe, competent doctors. But it's really important that we make sure that they keep these kind of diagnoses on their radar. And what we have as a process of clinical decision-making as doctors is we undertake what's called making a differential diagnosis. We talk about getting the diagnosis right, but we only do that by going through a process of differential diagnosis, thinking about possibilities before we rule stuff out or rule stuff in. And so what we've done in our T year, our second year, problem-based learning case, is we've introduced ME as a differential diagnosis. So students have to think about it. And what we've done is we've got a young adult patient who's presenting with fatigue and generalised aches and pains. It isn't the final diagnosis, but it's really important that they think about that. And students, we give them the guidelines as a resource. We give them your fantastic film, so thank you for that, and all the remaining information. And I think the final slide, actually, I was lying. This is the final slide. It's an educational trick. Hey, students. But really just to say that what we then do is we expect that students will revisit as they go on through their penultimate year and their final year, and will continue to keep this in mind as a differential diagnosis when they're seeing patients in general practice and in hospitals. And we expect them to undertake their own learning, but the resources that are available for them. And of course, because we're new, we'll have to see how this goes, see how students utilise the resources, and actually, I guess, ultimately it's to see what impact that has, but that's a long-term journey. So that's us in Ulster, and over to Neil at Queen's.
Brian, you picked up the point earlier on about how it's hard to change things. A supertanker when you do things all at the same time, and we've always done it that way. Well, thankfully, these resources have come quite at a good time for us because we are in a time of change, and we've been implementing a new curriculum at Queen's called C25, and the next slide there just picks up maybe some of the themes in that. We use case-based learning, we use strong curricular themes based on population and public health as well, and again we've got more time in general practice than we've had before, because these are the important elements of care delivery moving forward if we ever get round to transforming our healthcare service and doing what Bengoa has told us all along we all agree need to do, but I'm not a politician. So keep moving. So what do we do already? We don't address ME specifically in a case-based learning approach, but we do talk about chronic, unexplained and stigmatised illness, and we mention that a lot in types in the cases that we talk to try and talk about some of those attitudinal issues at the early doors in our course. We show the unrest film that was mentioned, and we're still trying to show that where we can. And we have a lecture as well in third year. But we're using the opportunity now, next slide please, to think about what we're going to do new. And we are embarking in year 2024-25 with our new 5th year for C25. So Linda's intervention was very timely, and we were able to use the film. And what we're planning to do in their final year rotation is to use the students' experience of meeting real patients that they will have seen over their time in medicine, because this is a common illness. They are bound to have seen it over their time in their primary care in 3rd year and 4th year and in 5th year. Show the film as well, and focus on 2 things. The knowledge piece, yes, the management stuff, what's in the NICE guidance, but focus on attitudes as well, and on the hidden curriculum, on the things we don't want them to learn, on the emotional and perhaps ethical drift that sometimes occurs in professional courses, and we both recognise that as a real issue for people entering medicine. So these are the sorts of things that we're wishing to try and tackle in that. Final slide is thank you very much. Just on behalf of both of us, we both wanted to just say thank you to you for the opportunity. Thank you for reaching out to us, because we do, as both institutions, stand very firmly that we have to engage with our client base, the people who we want to serve. We're here not just as universities to earn money, we're here to try and help the population here. And we think that by engaging with the public and the community groups such as yourself, that's the best that we can do that. So thank you very much indeed for your time. Thank you.